All right, everybody, can you see my screen right now?
Yes, coach.
All right, good job. Okay, again, good morning, everyone. We are live in YouTube right now. This is a live, this is a live session. Okay, so our topic for today is HIPAA compliance. Okay, so this is HIPAA compliance for medical virtual assistants. All right, let's begin. So for the table of contents, first is understanding the key principles of HIPAA. So that is privacy rule, security rule, breach notification rule, and then best practices for handling protected health information or PHI in a remote setting. So another one is to secure communication methods and data storage. All right. Okay, so what are the key principles of HIPAA? So number one is privacy rule. Number two is security rule. Then breach notification rule. So again, these are the key principles why HIPAA is very important. Privacy rule, security rule, breach notification rule. All right. So, what is a HIPAA certificate? A HIPAA certificate typically refers to a document awarded to individuals or organizations upon completing training programs focused on Health Insurance Portability and Accountability Act or HIPAA. Again, it's Health Insurance Portability and Accountability Act or HIPAA. So these certificates often signify that the holder has acquired knowledge about HIPAA's privacy and securities rules. So which govern the protection of payment health information. All right. And then next, what is the official recognition of HIPAA certification? So it's important to note that the US Department of Health and Human Services or HHS, the agency responsible for enforcing HIPAA regulations, does not endorse or recognize any third-party HIPAA certification. So this means that while such certificates can demonstrate an individual or in organization's commitment to understanding and implementing HIPAA standards, they do not equate to official compliance. So it means the HHS does not certify healthcare providers or their employees as HIPAA compliant. All right. So what are the purposes, purpose and benefits of HIPAA certificate? So number one, so despite the lack of official recognition, obtaining a HIPAA certificate can offer several benefits. So what are those? It can be beneficial for educational value. So training programs provide valuable information on safeguarding protected health information. All right. Which is crucial for healthcare professionals, professional development, and holding a HIPAA certificate can enhance an individual's credentials, potentially leading to better career opportunities in healthcare compliance. Okay, for those who are joining right now in our live session. Thank you so much. And then you can use our live chat from what country you came from. Are you from Africa, from Asia, or from Europe? Okay. I hope you will learn a lot from these live sessions. Okay, so next is professional development. So, holding a HIPAA certificate can enhance an individual's credentials, potentially leading to better career opportunities in healthcare compliance. Another one is organizational assurance. So, for organizations, having employees with HIPAA certificates can strengthen their compliance stance and demonstrate a proactive approach to data protection. All right. So, what are the limitations of HIPAA certificates? So, while it is beneficial, HIPAA certificates have limitations as well. So there is no legal standing. They do not absolve organizations from their legal responsibilities under HIPAA. This is not a substitute for compliance, or possessing a certificate does not guarantee that an organization is fully compliant with HIPAA regulations. So not recognized by HHAs, so it does not accept third party certifications as evidence of compliance. All right. A HIPAA certificate can be a valuable tool for demonstrating an understanding of HIPAA regulations and commitment to protecting patient information. Okay, however, it is not a substitute for actual compliance. So organizations must implement comprehensive policies, conduct regular training, and undergo audits to ensure they meet HIPAA's requirements. All right. I will just pause for uh, 1 minute. Let's try to wait for the others. Our others are still joining. I will just pause. All right. So the HIPAA privacy rule establishes national standards to protect individuals' medical records and other personal health information, or PHI. So it applies to health plans, healthcare clearinghouses, and healthcare providers who conduct certain financial and administrative transactions electronically. All right. So, what are the key principles of the privacy rule? So, number one, permitted uses and disclosures. So, PHI can be used or disclosed for specific purposes without an individual's authorization. So, these include treatment. So, it means sharing PHI with other healthcare providers involved in an individual's care. Payment or disclosing PHI to health plans to get paid for services. Healthcare operations using PHI for activities like quality. And public interest benefit, of course. The disclosures for purposes like public health activities, reporting abuse, and law enforcement with specific limitations. All right. So, how about individual rights? So, our patients or clients have individual rights. They have significant rights regarding their PHI. Okay, so right to access. Individuals have the right to inspect and obtain a copy of their PHI. Right to request amendments. So, individuals can ask for their PHI to be amended if they believe it's inaccurate or incomplete. Right to an accounting of disclosures. So, individuals can request a list of certain disclosures of their PHI made by a covered entity. So there's a right to request restrictions. So individuals can request restrictions on how their PHI is used or disclosed, though these covered entities are not always required to agree. Okay? So right to confidential communication. So individuals can request to receive A. Communication from a covered entity by alternative means or alternative locations. Okay, so what are the minimum necessary principle? So when using or disclosing PHI, covered entities must make reasonable efforts to limit the amount of information used or disclosed to the minimum necessary requirement or for the intended purpose. So this principle doesn't apply to disclosures for treatment purposes. So these are other terminologies. We need to focus on the consent versus authorization. Okay, so when we say consent, while often used in healthcare, the privacy rule generally permits uses and disclosures for treatment, payment, and healthcare operations without an individual's written consent. Okay? So when we say authorization, it uses and disclosures outside of treatment, payment, and healthcare operations. So it can be used for marketing, research, or not specifically permitted. Okay? This is a valid written authorization from the individual is typically required. All right. So how about BAS or business associates, BAAs? So these are covered entities that must have written agreements, okay, with their business associates. So these entities that perform functions or activities on behalf of a covered entity that involve the use or disclosure of PHI. This is to ensure that the business associate protects the PHI. Okay. So, those who are still joining, you can use the live chat, okay? And then you can put there from where did you come from? From what country? Are you from the Philippines? Are you coming from Kenya? Are you coming from Nigeria, Indonesia, or Malaysia? So most of our students are coming from these countries or cities. Okay. We also have a student coming from North Macedonia that is in Europe, right? So here are the key principles of the security rules. So risk analysis and management. So covered entities must conduct a thorough risk analysis to identify potential threats and vulnerabilities to EPHI and implement security measures to mitigate those risks. All right. Okay. Next is administrative safeguards. These are policies and procedures to manage security measures. Key aspects include security management process, developing and implementing security policies and procedures, and designating a security official, and then implementing security awareness training and access control for employees, and establishing policies and procedures for granting and terminating access to EPHI. All right. So security awareness and training, it provides training to all workforce members on security policies and procedures. Security incident procedure means developing procedures for responding to security incidents. Contingency plan. So this is developing procedures for responding to emergencies. So just in case of disaster recovery or data backup. Okay, and then evaluation. This is periodically evaluating the effectiveness of security measures. All right. So for the physical safeguards, these are physical measures to protect electronic information systems and the buildings and equipment that house them. So what are the key aspects that include? So facility access control. So limiting physical access to facilities where EPHI is stored. Workstation use, establishing policies for the use of workstations. Workstation security, implementing physical security measures for workstations, device, and media control. So, implementing policies and procedures for the disposal and reuse of electronic media containing EPHI. Alright. Okay, next is technical standards. So these are the technology and the policy and procedures for its use that protect EPHI and control access to it. So what are the key aspects? So these are access control, audit control, integrity, and person or entity authentication. Okay. So it means that whenever we are using any hardware, software, or procedural mechanism to record and examine activity, the information system that contains EPHI, this is always have technical safeguards or controls. Okay. Okay, next is the HIPAA breach notification rule. So the breach notification rule requires covered entities and their business associates to notify affected individuals. So the Department of Health and Human Services, and in some cases, the media following a breach of unsecured PHI. So what is a definition of a breach? So a breach is generally defined as the acquisition, access, use, or disclosure of PHI in a manner not permitted under the privacy rule that compromises the security or privacy of the PHI. There are some exceptions, such as unintentional access by a workforce member within the scope of their employment. All right. So, what are the risks assessment? So, covered entities must conduct a risk assessment to determine if a breach has occurred and if there is a low probability that the PHI has been compromised. So, this assessment considers four factors. So, what are those? The nature and extent of the PHI involved, the unauthorized person who used the PHI or to whom the disclosure was made, whether the PHI was actually acquired or viewed, and the extent to which the risk the PHI has been mitigated. So, I know this is a little bit overwhelming, but we need to discuss the importance of HIPAA, all right? So, notification requirements, if a breach is determined to have occurred, there is more than a low probability that the PHI has been compromised. And then individual notification. So covered entities must notify affected individuals without unreasonable delay and in no case later than 60 calendar days after discovering the breach. Okay? So this notification must include specific information such as a description of the breach, the types of information involved, and the steps that individuals should take to protect themselves. All right. So these are all other terminologies related to PHI. Let's focus on the best practices. Okay? So what are the best practices for handling PHI or protected health information in remote setting? Because this one is applicable to all of you. If you will be working remotely as a medical virtual assistant. So number one, you have to use secure communication channels. So what are those? Encrypted email and messaging platforms that are HIPAA compliant. Okay? Virtual Private Network or VPN to access internal systems. Avoid using public Wi-Fi. Always use a VPN, okay? Whenever you will access EHR or EMR. And then number two, you have to ensure that devices are secure. Enable full disk encryption on all devices used for work. So you have to use a strong, unique password and enable multi-factor authentication or MFA. Keep operating systems, antivirus software, and applications regularly updated. And then you also have to limit data access and sharing. Okay. That is why I always remind you, right? Whenever you will use our username and password, our credentials, you are not allowed to share it to anyone that is not related to the company. Okay? Apply the principle of least privilege. Only authorized personnel should access PHI. Do not share PHI through unsecure methods like SMS or personal email accounts. Okay? Those are very important. And then maintain a secure work environment. So always work in a private space where others cannot overhear or see PHI. Use privacy screens on monitors if working in shared environments, and then lock your screen when stepping away. Okay, so just an example, if you will be working in some clinic or private practice, there are some doctors that will ask you of what your remote work setup looks like. So sometimes they will ask you to submit a video or picture of your workstation. It's because your monitor or your computer or your laptop should not be facing a door or should not be facing a window wherein somebody can take a picture of the patient records or somebody can pass by and see what you are doing on the screen. So, if you will be working remotely, it's very advisable that you have a separate room wherein you can do your tasks privately because you will be dealing with patient records, right? Handle physical documents carefully. Avoid printing PHI unless absolutely necessary. Secure physical documents in laptop cabinets and share documents with PHI using a crosscut shader when no longer needed. So this one is for those that are on site. Okay, this is not applicable for us working remotely. Okay, so implement and follow a remote work policy. So this one is for us. So you have to create formal remote work and security policies, conduct HIPAA training tailored for remote environments, require attestations from employees acknowledging policy adherence, and then use HIPAA compliant cloud services. So what are those? You can store and transmit PHI only with services that sign BAAs. And then you can also use common compliance services like Microsoft 365, Google Workspace, and Zoom for healthcare. All right. Monitor and audit. So this is enable logging and monitoring for all access to PHI. Regularly review logs for authorized access. Conduct risk assessments periodically. Okay. So next is, I think this will be the last topic for this one. Secure communication methods and data storage. Okay, so how are we going to secure communication methods? Okay, number one, through email. So you have to use HIPAA compliant email services with end-to-end encryption. So just like what we are doing with our client, right? You can only log in to company emails. Personal emails are not allowed to use for processes or procedures. So you have to ensure that TLS encryption is enabled and obtain BAAs from providers or business associate agreements. Okay. For messaging and chat, so use secure platforms. These are examples. Okay. So every company or every client, they have their own secure platforms that always follow HIPAA compliance. So avoid using SMS or consumer apps like WhatsApp unless explicitly approved and configured securely. Okay. So for the video conferencing, use HIPAA compliant video platforms such as Zoom for healthcare, and then the other are examples. But the most common one is Zoom, right? And it also depends on the company. What are the other platforms or apps they are using for communication. Just like with our client, we are using dial pad. Okay. So phone calls. So use encrypted VoIP services where possible. Be mindful of your environment. So avoid discussing PHI in public or open spaces. So for the secure data storage, these are the common practice, right? The cloud storage. You can use HIPAA compliant services like Google Workspace, Microsoft OneDrive, Dropbox for Business, and then make sure that you ensure all PHI is encrypted at rest and in transit. Okay. So for the local device storage, you can always use a full disk with encryption, and you can also enable automatic screen lock and MFA. For backup, you can always use HIPAA compliant sign BAA and test backups for integrity and accessibility. Then for access controls, you have to enforce role-based access to sensitive data, implement strong password, policies and multi-factor authentication. So you have to maintain audit logs to track access and changes to PHI. All right. So I think this is the last topic for HIPAA compliance. All right. So again, HIPAA is Health Insurance Portability and Accountability Act. So this one is very important for the security of our patients' details and the patient's records. And we need to make sure that there's always confidentiality in everything that we process, and we follow company rules regarding PHI security. All right. So that is our session for today. Okay, I will do another session after this one. So those that are in Zoom, you can stay on the Zoom while I end this live session. And then for those that are in the live session, thank you for joining us for today. I will do a live session 2 to 3 times a day for this week while it's Holy Week. All right. So I have more time in doing this live session only for this week. Okay. I will try my best to do 2 to 3 times live sessions with you all. So for all our viewers coming from Africa, thank you so much for trusting VA Bootcamp Training Services. A lot of our viewers are coming from Philippines and Africa. All right. I know that working remotely, especially for those beginners or those who are aspiring to be a medical virtual assistant, transitioning is not that easy. All right. It's because the clinical setup or your work experiences before is definitely very different with online work. Okay. So I highly encourage everyone that are watching right now, if you are interested in an online training and internship, you can definitely reach out to us. So we have our Facebook page, our YouTube channel. We also have our LinkedIn account and website. So there are a lot of ways that you can reach out to us if you are interested. What is our advantage in the VA Bootcamp training internship? You will have the experience of real US clients. So we are not just doing theoretical discussions. You will also experience how it looks like or how does it feel to work as a medical virtual assistant. In the live sessions, of course, um, we cannot show you the live patients or the real EHR. It's because of HIPAA compliance. But if you will enroll in our training and internship, of course, we can provide you our access so that you can have the real experience how to handle electronic health record, and then how to handle real patients, and then how to navigate spreadsheets, how to do SOPs, how to communicate and engage with real patients and providers. All right. So we have one-on-one coaching, and also we have group discussions, and we also offer slides. So of course, every individual's learning curve is totally different with one another. So others are learning from slides, from reading. Others are learning from video recording, through navigation. So whatever is your learning curve, we are here to provide you with all those methods, just to make sure that you will really learn a lot from this training and internship. All right. So thank you so much for today, everyone. I will try to do a lot of live for this week. Okay. While it is still Holy Week, it's holiday season. So I hope everyone is doing good. And let's see again on another session. Thank you and have a good day, everyone. Have a great day. Bye bye.